Hello, so this is going to be my presentation on the economics of healthcare. And throughout this presentation, I'm basically going to go over the basic economics, the theory of healthcare, and with a focus on the US, but I'm also going to be comparing it to different countries, such as Canada, France, UK, stuff like that, using data that I found. Okay, so getting started, the basic economic model of anything, basic economic theory is that supply and demand controls the market prices. The main parties concerned in an exchange of a good or service are the buyers and the sellers. You go to the store, you buy a candy bar. Um, the only people involved are you and the store. Um, Consumers give money directly to sellers. You're giving money directly to the store for that candy bar, and price impacts a buyer's decision to consume. If a candy bar is like $10, you're not going to want to buy it. Or if maybe they have like a 3-for-1 deal, you know, you're going to want to buy it more. It'll impact your decision to consume that, and there will be an efficient allocation of resources will occur naturally for perfect competition. Obviously, this isn't true for all goods, but the basic economic theory says that this will in general be true. How the healthcare economic model differs is that there are third parties who have an interest in your consumption, like the government and your insurance companies, who they have an interest in whether you're going to the doctor's office or not, because obviously the insurance companies are paying for that. Patients are the consumers and often do not know what you need. So you don't, if you're sick, then you might not know exactly what medicine is right for you, and you might not know if the medicine that you're receiving is the best quality, is the best like type for you, and whether it's going to have the best effect. Um, you're basically relying on your doctor to tell you that, and there's the internet and stuff now, which makes it better, but there's no real assurance. And then providers are usually paid by private or government health insurance, not the patient slash buyer. You go to your doctor's office and you might pay your $20 copay or whatever it is, but you're not paying the full price of that. Your insurance company is, which makes it a little. Which, going off of this, there are certain rules set by these insurance companies that determine the allocation of resources more than market prices. So basically, how major medical insurance works is that there's usually a deductible, and this is how much you're going to pay of your medical bills before that insurance company steps in and starts paying. This can range anywhere from $0 to $25,000, depending on what type of insurance policy you have. After that, you have what's called coinsurance, which is a ratio of what that insurance company is going to pay of your medical bills once you do pay the deductible. Say your deductible is $2,000 and your medical bill is $10,000. So after you pay that $2,000, your insurance company then is not going to pay that full $8,000 that's left. It's going to be a certain ratio in your policy. Let's say it's 80-20 is a general ratio. So they're going to pay 80% of those $8,000 that are left, and you're still going to have to pay that 20%. Then you have OOP. It's called your out-of-pocket maximum. A lot of policies will have this basically as kind of a way to not make it be scary for people who might have potentially a very large medical bill coming. Let's say you had like heart surgery, $100,000, and your coinsurance says, oh, you have to pay 20% of that. So insurance policies will have a plan set in place, basically saying that your out-of-pocket maximum, let's say it's $10,000, like at most you will pay $10,000 um, of that $100,000 bill. After that, the insurance company will cover 100%. And then there are certain limitations slash exclusions set in place. So these insurance companies will say basically you can't go to any doctor that you want or use any medicines that you want. For example, they might want you using certain types of medicines or going to certain doctor's offices, which you might not have gone to had you had free reign if it were a typical market. So this all affects the market. Next, we're going to go on to the importance of healthcare. And the main reason that healthcare is such an important topic and it's widely discussed today is because of the positive externalities associated with healthcare. One person having healthcare positively impacts those around him, not just himself. For example, vaccines. If you get a vaccine and you can't get sick with a certain disease, you also cannot get others sick with that certain disease. And then going off of this is that medical research discoveries are very, very positive externality because one person making a discovery in like a better treatment or a new drug um, positively impacts the entire world because now everyone can start using that better treatment or better drug, in a perfect world where this information is shared. Once something is discovered, then everyone benefits from it. Next, we're going to be going over the quality of healthcare. So when you are sick, you don't always know the best treatment. We went over this before. You have a reliance on the doctor/physician that you choose. And this isn't perfect because even if, for example, you are sick, you go to the doctor and you get better, there's a variance in your immune system to everyone else. Maybe the medicine that the doctor gave you didn't actually make you feel better, but your immune system just naturally fought it off, and you thought, oh, this doctor made me feel better. So you don't actually know if they are a good doctor, so you might rely on them in the future, but you don't actually know. Not knowing is obviously a problem, so because of that, there's regulations on quality. Government makes doctors, nurses, dentists, health professionals. You need a license, a medical license, in order to practice. And going off of this, medical schools need to be accredited by the medical profession in order to be allowed to basically teach you how to practice. And then most hospitals are nonprofit in order to avoid self-interest in maybe giving you a more expensive drug versus a cheaper drug that might be more effective, stuff like that. With this regulation, there are downsides though. It is very difficult to open a new medical school. Based on the research, there are a ton of paperwork filings and accreditations that you need to receive, and the logistics behind it all makes it a very high barrier to entry business to get into, opening a medical school. And what this does is it limits the supply of doctors because oftentimes these medical schools will also be very difficult to get into. Um, and then another downside of regulation is that the FDA, at least in the US, is very slow in approving new drugs, which could have benefited the people who need them. An example of this might be the coronavirus vaccine. Um, there are many treatments and vaccines being researched, but we hear dates being thrown around of 2021 or 2022 until these get approved, when maybe they are effective and they could help us now, but they wouldn't get approved until later because in general, the approval process is very slow, which is a trade-off because obviously a very slow approval process means that you're going to have only quality, but then you could be hurting people in that lag time as well. Okay, so another big facet on healthcare is insurance. So insurance arises from uncertainty in what medical treatment you will need in the future. Um, and most people are risk averse due to high potential costs. For example, on any given day, you might find out that you have some type of infection or disease, and these medical costs can be very, very expensive. Um, no one, even like healthy individuals, is really 100% safe at all times to avoid these medical costs. You could break your arm at any time. That's very expensive. So then, due to this, many problems arise from insurance. The first of these problems that arises from insurance is this moral hazard. So basically, people with health insurance have little reason to keep their costs down. So what they'll do is, you start feeling a little sick. Maybe if you don't have insurance, you don't want to go to the doctor's office because you don't want to pay to go when you could probably fight off the disease on your own. But if you have insurance and you're not paying anything, then you're going to go, and what this does is this uses up resources, uses up tests for things that could have been avoided. You could have just stayed at home a day or two and taken over-the-counter prescription, or not prescription, over-the-counter drugs to fight off whatever you are doing. And this is typically offset with copays that are usually low, but enough to deter frequent visits. For example, your insurance company might say you have to pay $30 per doctor's visit. It's not the full like 150 or 200 or whatever it would be, but it is still something to deter you from going basically just willy-nilly. The next problem is this problem of adverse selection. Um, this arises from the fact that there are attributes in patients that aren't observable by insurance companies always, such as chronic illnesses or just a general proneness to get sick more often, immune deficiencies. And what this does is this raises the cost for everyone because this makes insurance companies charge for above the average person's level of cost of insurance. And what this does is this can lead to a death spiral. So when we talk about a death spiral, so suppose that a person's health profile is private information and insurance companies must charge everyone the same price. At first, it might make sense for a company to base the price of insurance on the health characteristics of the average person in the population. But after it does so, the healthiest people may decide that insurance isn't worth the cost anymore, so they drop out of this insurance pool. With a sicker group of customers than expected, the company then has higher costs and they have to raise the prices again of insurance. And the higher prices now induces the next healthiest group of people to drop insurance because they're still relatively healthy, and these prices are just getting too high, so they drop their coverage. And again, this drops the price. This raises the prices for the people that need it, and the insured pool becomes less and less healthy, and the uninsured pool are healthier, but they are all uninsured, and the prices just keep rising up. That's why it's called the death spiral. Leading off the problems with insurance, there's the idea of a right to health care. If someone gets sick, it seems wrong morally to deny them treatment based on their income level. And this makes sense. If you are lower income and you get sick, there's no reason that you shouldn't be able to go to the doctor just because you are lower income. You should have access to these resources. So this leads to government-run healthcare systems such as Canada, England, France, and then some mixed involvement like here in the US with Medicare, Medicaid, and the Affordable Care Act. So going more on these government systems, we're first going to go over Canada. So Canada has what's called a single-payer system. It means that they fund their healthcare through taxes. Their doctor's offices are private businesses paid by government. Hospitals are public property, and the staff are public workers, and they get their benefits as if they were government employees. But people pay for prescription drugs and dental care, or they get their own private insurance to cover things like these. Next, we have France in the government-run systems. So in France, all healthcare providers are provided by several nonprofit insurance funds. So it's not a single-payer system. All citizens are required to get health insurance, but a lot of this is funded through their taxes. People choose their own doctors and providers, but hospitals are private businesses. They are not run by the government. They are run by corporations, individuals. And the third government-run system that we're going to look at is the United Kingdom. So they have a socialized healthcare system, which is funded and controlled by the government. So the government uses taxes to pay providers, hospitals, and doctors' offices, which are all private businesses in the United Kingdom, which differs from France and Canada. So with these government systems, the main problem that arises, and this holds true in all three of these systems based on the data, that there is a significant waiting time for certain operations. Let's say you need a kidney you might be waiting several months or years even to get an operation that you need. And even just for regular general checkups, these countries usually face waiting times of 4 to 6 weeks on average. For non-emergency operations, like unless you're dying right there on the spot, you might need to wait 4 to 6 weeks until you are able to see a doctor. And because of this, many wealthy people in government-funded systems, mainly in Canada, will actually go to the US to avoid these wait times because they can afford it. So as we talked about before, the US has a little bit of a mixed system in that there is still government involvement, but it is not completely government funded. So all providers, doctors' offices, hospitals, they are private businesses. They're independently owned. They are not run by the government. But they do have a single payer system for those over 65 with something called Medicare. Um, Basically, it is just like in Canada, single payer system. You have free health insurance if you're over 65 and a citizen of the US. And then Medicaid is a similar system which covers low income households. But what this does is it actually leads to people right above that poverty line who don't apply for Medicaid to generally be the most uninsured group of people because they are still lower income, but they cannot afford private health insurance still. So what the U.S. did is they passed the Affordable Care Act, and what this does it's a method to avoid the death spiral talked about before. It subsidizes health insurance, and it makes health insurance companies make everyone pay the same rates. Give everyone the same prices, and it also induces a fee in that if you don't have health insurance, you have to pay this fee. So it gives a real incentive for those uninsured people to then acquire health insurance, which is now, in a perfect world, it should be cheaper. The goal of the act is to make it cheaper for everyone. So going more into the U.S. system and talking about certain reasons why it is the way it is and why it may need some reform. So the first reason is that people are living longer. Life expectancy has gone up from 47 to 78 years from 1960 to 2015. Infant mortality is currently under 1%, and the percentage of population above 65 has increased from 9% to 15%. Next is that healthcare spending has gone from 5% of the GDP in 1960 to 18% of the GDP in 2015. And the reason for this is that medical care, is a personal service. It's much like getting your hair cut from a barber. So, for many providers of personal services, productivity doesn't change over time, but as the rest of the economy experiences technological progress, labor productivity and overall wages tend to increase. So people supplying personal services expect bigger wages to come with that, along with the rest of the labor force. But without much productivity growth in healthcare sectors, the only way to give these service providers higher wages is for the prices of the healthcare services to go up. And this is also because advances in medical technology have only increased costs instead of reduced, unlike other industries. If you're pregnant now, for example, there's 100 different tests that you can run to tell whether you're going to have a healthy baby, which simply did not exist before. These tests cost money. Things like X-rays, CAT scans, these have all received technological advances. You can even get like body fat percentage tests, which all cost money. So healthcare is now more expensive. And in the US, obesity is also higher, much higher than in other countries, and there are many health associated costs that come with obesity. So some more of the US costs that affect our healthcare system today is that the US is actually paying 30% more for the same pharmaceuticals than Canada, the UK, and France. And this is actually one of the biggest attacks on the US healthcare system. You hear Bernie Sanders talking about it all the time. These pharmaceutical companies are taking advantage of the US system and they're charging ridiculous prices. Um, and there's a higher quantity of healthcare in the US due to insurance companies paying. Deductibles help to reduce this, but not all the way. Also, going with this, prices for similar treatments are higher in the US, and the US on average spent around $8,475 per person on healthcare in 2012, whereas even some of the more wealthy countries, such as Switzerland and Norway, are only spending around $6,000 per person. And then Germany, France, and the UK, they spent between $3,000 and $5,000 per person, respectively. Prices are also higher in the US due to administrative costs of insurers and providers. Um, so what this basically means is that since there are all these insurance companies and all these providers, which are all private businesses, there are actually certain administrative costs and all the paperwork that needs to be filed, all the contracts, all the disputes, all these rules, all the fine print. All these teams, all these companies need teams of lawyers. They need people that are able to file this and account for everything. The US also has the highest rate of hospital admissions in the world for preventable conditions. This goes along with the higher quantity of healthcare. So basically, there's a lot of more people in the US going to the doctor for, um, something minor that could have been prevented. Um, and then there are also the highest rates of medical, medication, and lab errors. So basically, the US has the highest amount of errors in, over medicating or giving the wrong medication or having lab results be incorrect or erroneous. So in order to keep costs down, the US passed what's called the Affordable Care Act. And this was an act that was not very easy to pass. There was a lot of debate, many years of debate going into it. There's still debate about it. And this was not easy to pass due to something called the Iron Triangle, which is the mutually beneficial relationship between members of Congress, bureaucrats, and lobbyists to maintain the status quo. And it kind of makes it harder for policies to get done. There's a lot of politics to go into it. Democrats versus Republicans, stuff like that. It is very hard for something more to get passed. So what the Affordable Care Act did was it required private health insurance companies to charge everyone equally, and it also subsidized insurance, gave money, made it cheaper for everyone by injecting some money into insurance, and then it made a fee for not having insurance. So if you were uninsured and you wanted to stay uninsured, then you would have to pay the government a fee, which incentivizes obviously you getting insurance, which you're gonna have to pay anyways. Um, the Affordable Care Act also mandated a move to electronic record keeping, which makes it easier for everyone and tries to keep those administrative costs talked about before down. The Affordable Care Act has had mixed reviews over the years since it was passed, as shown in the figure. The blue is all the people that found it favorable, and the orange is all the people that found it unfavorable since it was passed since before it was passed in 2011 up until even now 2020. And in recent years, the amount of people that found it favorable has increased, but it has not always been that way. As you can see, the numbers have been just kind of jumping up and down. Sometimes more people found it favorable, sometimes less. So it has had very mixed reviews over the years. So this leads to the ongoing policy debate in the US in health insurance. So the left wants to see a public option, government-run system. Some want to see a single-payer system, but most do agree that they want to eliminate private insurance. They want some type of way for every American to be able to be covered and keep costs down, mainly from the pharmaceutical companies. You hear Bernie Sanders talking about it all the time. While the right wants to see a reduction in government involvement. They want less regulation on healthcare, so they want more drugs to be passed better. They believe that perfect competition and the insurance companies will actually lead to an efficient market. So we talked about before how healthcare differs in that perfect competition will not always arise in the healthcare market, but the right believes that perfect competition will arise in the insurance market because insurance companies will try to get people to join their insurance, so it'll eventually all level out. So they believe that a centralized system limits freedoms and reduces innovation. So if there's no incentive to going and discovering a new drug, if you're getting paid anyways, then there's no reason to do it. And if your only options are to go to these government-run hospitals and you can't pay for your own, then that is a limitation on your freedom. And then they use the waiting time arguments against single payer as a deterrent to go to it, because, for example, now a lot of the wealthier people in Canada, to avoid these waiting times, are going to the US in order to avoid these waiting times. And if they're just going to be prevalent in the US as well, then there's no reason for them to do so. And in turn, the wealthy people in the US might go to different countries in order to avoid these waiting times. And it'll just be an issue altogether. So going forward with the US system of healthcare policy, we're in really uncertain times right now. 16 million Americans have lost their jobs due to COVID-19. And since 1/3 of Americans receive their insurance through their employer, you might think that this leads to a heavy loss of insurance. This is actually not true due to unemployment insurance by the US and all the different stimulus packages going on. So that helps on that front. And then more people now are actually eligible for Medicaid. So if you have lost your job and now you fall under that poverty line, you are eligible for Medicaid, but these times are very uncertain. So it is still unknown what the effects of COVID-19 on healthcare will be in the future. So to wrap it up, healthcare policy is no real right answer. As can be seen, there are certain pros and cons to having like a government-run system or a completely free system or a mixed system like the US. And this is due to the moral dilemmas that arise, talking about treating one person over another, which just seems wrong, or treating someone based on income level. Another reason that makes this so complicated is that economic theory does not always apply due to the third parties being involved, the fact that patients don't really know what they need, and that healthcare providers aren't paid by those patients. So this makes healthcare a very delicate topic, and one that will probably be discussed for many, many years to come in policy. So that is all. This is my presentation. Normally I would ask for questions, but that's it. Here are my citations. I got a lot of my information from the Kaiser Foundation, and I also watched a few YouTube videos in order to educate myself. And yeah, that's all.